All right, so good morning. It's July 25th, 2011. My name is Dr. Gregory Buford. I'm a plastic surgeon in Denver, Colorado, and I am having the distinct pleasure and honor of interviewing a colleague and friend, Dr. Julius Few, a board-certified plastic surgeon in Chicago, Illinois. Julius, before we get going, tell our listeners, our viewers, a little bit about yourself, if you would.
Well, Greg, thank you. It's an honor for me. I'm a board certified plastic surgeon in Chicago.
So Julius, this morning we're going to be speaking about facial rejuvenation of skin of color. Now this is a topic that you've spoken on extensively. I've heard you speak at a number of major meetings. You're truly an expert authority in this area, so we'd like to pick your brain as to what is the latest and greatest. Now to get going here, to start, tell us a little bit, if you were speaking to someone about skin and they have skin of color, how is skin of color different physiologically, and why? What's the big deal? Why should we be concerned about the difference?
Well, I think probably one of the most important things is the understanding that people of color looking at cosmetic treatments, cosmetic medicine, is one of the fastest growing groups in our space in the U.S. And it has become really increasingly important to understand some of the differences. So I first have to applaud you for wanting to look at this on your program. The big difference is it really includes what is true about life in general. There's always a good part and a bad part to anything. The good part in having darker skin is that it's going to have actually inherent protection against sun-related damage. So the sun is not going to be as harmful to a person of color skin, and in turn you're not going to see wrinkles the same way you would in somebody who has really fair skin. And so that's going to be an obvious advantage, which means that aging from an aging related standpoint, you're going to see aging signs much later on the skin. But the disadvantage is that skin of color is, because of the makeup of the deeper layers of the skin and the pigment cells that also make up the skin, that darker skin is going to be much more prone to bad scars. It's going to be much more prone to forming hyperpigmentation or getting dark spots with the most minor thing. I mean, you can have a minor irritation, a pimple or what have you, and it can leave a dark mark that takes a year or more to go away. So that's the challenge. So skin of color in general also is going to be thicker, and it's going to be oilier in its makeup, which I also believe is one of the reasons why you tend to see aging changes later. And also because of that makeup is probably one of the reasons why it's more prone to bad scarring.
Mm-hmm.
This is what somebody with skin of color needs to know, for sure.
So all good points. So let me ask you, so someone comes into your office, okay? Someone comes into your office and says, I'm 55 years old, my skin simply doesn't look the way it used to, I need a refresher. What options are available, and how would you approach the analysis of their skin type, and what would you tell them to do, and what also not to do, given the relative advantages and disadvantages of the pigmentation?
Yeah, that's a great question, Greg. I think that the big thing, and this is what I do every day in my office at the Few Institute, is to really look at three main components, three main things. One is the skin and how the skin has been affected, and as I told you, darker skin, it's going to have less of an effect at 55 than lighter skin. But there's still two other factors. The two other factors include volume loss, which is universal, happens to all ethnicities and can be predictable. And then the other is drooping or sagging of the tissue. So these three components have a different role in each person, and so what I tend to do in my patients of color, often I'm focusing on two of the three issues, meaning the loss in volume and the lifting of tissue. And so what I find in the mid-50s, the biggest issue is loss of volume. Interestingly, the drooping or sagging of the tissue tends to be less pronounced as well. And I think in part that's due to the fact that the skin being thicker and more robust in darker skin types, you're going to have better internal support. So in turn, these patients who come in who are wanting to just get a refresher to look a little better in their mid-50s, they do really, really well with fillers, injectable fillers like Restylane and Juvederm, or even fat, or Sculptra. There's a whole host of fillers that can be used to enhance in a non-surgical way, and why that's really important is that helps to lower the risk of some of those bad things like scars, which if you do a facelift in darker skin, that's going to be an increased risk. And also if you do laser in skin of color, that's a very challenging area as well.
Exactly. One thing I'm going to point out, and you made a very, very, very good point there, is the multidimensional evaluation of skin and facial aging in any ethnicity. We all age. There's no way to stop aging. So looking at fillers, looking at volume replacement, very, very effective. And I think a lot of us as plastic surgeons, we're trained to be surgeons, but we're realizing now the benefits of volume. So it's really approaching the facial aging on a number of different levels really gives you a very synergistic effect long term. Now, you talked a little bit about watching out for lasers. Tell me a little bit about if someone doesn't come to someone like yourself. The biggest risk nowadays is that laser clinics are literally popping up on every corner. So not everyone is going to be as ethical or as well trained or well versed in how to work with all different skin types, and they may recommend a procedure that's not appropriate. So what would you tell someone of color? What type of lasers do you want to look for? Are there lasers that are safer, and are there lasers that they should try to avoid?
I would say that definitely it's critical to go to someone who has experience, and they need to be able to tell you and show you what that is. I think the other is ideally staying away from CO2 laser. I think CO2 laser, especially in darker skin types, no matter what somebody says, it's a challenge. And I have a lot of experience with laser and skin of color, and I will not use a CO2 laser. I tend to use an erbium laser, and I like to use a fractionated erbium laser because what I found is, and this is from our experience as treating a lot of burns, you and I have that in our experience. The reality is we know that skin that is allowed to heal more rapidly will have a lower risk of scarring. So that's why I like the fractionated laser, because I'm leaving islands of skin that can heal quickly. And so it's a godsend for skin of color.
For our viewers that are not as well versed as yourself or myself on the difference between the CO2 and the erbium laser, could you briefly, just in a short paragraph, point out basically what is the difference?
Yeah, so the CO2 basically laser is defined by what it passes through, and so the gas. So CO2 by its nature has a higher wavelength, and because it has a higher wavelength, it tends to be more attractive to pigment and water. So CO2, any laser will take up the laser energy will be taken up by the skin. And the thing that you want to control in skin of color is how much you're heating that skin up. If you heat the skin up too rapidly or too much in dark skin, you will get scars and pigmentation problems. So the secret is using a technology that will limit how much you're heating the tissue, but yet doing enough to make it work. And CO2 is just, think of it like a blowtorch. It's just too powerful on dark skin. You need something that's going to be much softer, almost like the difference between a flashlight and a blowtorch. The blowtorch, everything's going to get burned up. Flashlight, it may heat up a little bit, but you're just going to be able to do what you need to do safer. And I think that's the way in general I look at it.
Very well said. Now, so if someone comes into your office again, say they're in their early 40s. I see a lot of patients. My patients tend to be maybe a little bit younger, 30s, 40s. They're going through life changes. They've had kids. They maybe have gone through a divorce. Or now back in the dating scene. They're out more socially. They just want to freshen up. Could you give me 5 tips that you would tell them about how to look their very best? And they don't need to be surgical. I mean, I think there's a lot of emphasis now on minimally invasive technologies. So what would you focus on? Five simple tips to look your very best.
Yeah, I think the 5 simple tips. One, to use a sunblock, especially in areas that have pigmentation irregularities. That's absolutely easy, cheap, and effective. Number two would be to treat areas that are starting to crease or wrinkle. The forehead is classic, and around the eyes, using a botulinum toxin. Now we have 3 available. I think using them effectively can really help to slow down the aging or the kind of the tired look. Number 3 would be when volume changes start to occur, treat them early, because if you prevent the problem from getting too severe, you can change the pathway of aging again. So it's going to be much more cost effective, and it's going to be much more effective in terms of long term to treat these signs relatively early. I think the fourth has to do really with the idea of good skincare. So really in terms of skin of color, avoiding things that are rough on the skin like alcohol, a lot of astringents that are available tend to strip away vital oils, which are really, as I've mentioned previously, really help to nourish the skin. So you don't want to do that, especially in skin of color. I think there's a common misperception that you want to strip away all the oil because oil is bad, and the truth is it's not. So I think that's a fourth pearl to avoid. And then lastly, makeup. I think makeup is very useful. Mineral based is better. It has a natural sunblock protective factor in it, and using makeup that is higher quality is better. And there's so many makeups now that are available that actually have really probiotic properties. So I think that that's yet another thing that is often, especially for women of color, taken for granted.
Those are some great tips. Very good tips. Well, Julius, I think that that's a lot of information, a lot of very healthy information for our viewers. I appreciate your time. It's been an absolute pleasure speaking with you as always. In concluding, can you tell our viewers how to contact you? Do you have a website that they can go to that they can see your masterful work and learn more about what it is that you do?
Yeah, well, first, thank you very much for inviting me, Greg. It was a lot of fun. The best way to reach me is at fewinstitute.com. Gives a lot more information in terms of the philosophy and what we're all about. And then also the Few Institute Skin Suite. That is really a site that's dedicated to our non-surgical work, which we do a lot. So I would encourage anyone who's curious. They can learn a lot more that way. And again, I congratulate you for your excellent work.
Thank you, Julius. It's been a pleasure, and I thank everyone for watching our video here on B. And we look forward to seeing you again very soon.